Hey, all right. Well, hello, everybody. My name is Strat Maloma. I'm an associate director for advocacy and community engagement with AARP in California. AARP is a nonprofit, nonpartisan organization that empowers people to choose how to live as they age. Thank you for joining us for the second in our series of interactive career conversations with interesting people. These conversations are designed to recognize and celebrate the achievements of African Americans in unique and unfamiliar careers, and also to share learnings and insights from those currently working in those fields. If you can see it, you can be it. Through these conversations, we hope to provide young people, their parents, their guardians, their grandparents, information that might be helpful as they prepare for their own possible journey into some of these unique and aspirational careers. So we hope that you will join us as we meet inspiring people working in interesting fields like healthcare, winemaking, and more. And I hope you will join the discussion by asking your questions, sharing your comments, experiences, thoughts. And if you know of somebody that might benefit from these talks, please invite them along to our next conversation. Shortly, we are going to meet our interesting guest for today's conversation. And as always, we've set aside time to hear your questions and also your comments. Now, let's meet today's interesting person that we're talking with today. It's my pleasure to welcome author, health advocate, and America's favorite nurse, Nurse Alice Benjamin. Nurse Alice Benjamin is a nationally board certified family nurse practitioner and cardiac clinic nurse specialist who has over 2 decades of experience in healthcare. She has appeared on numerous TV channels and shows, including The Doctors, BBC, Good Morning America, NBC, CNN, Fox, True TV, and more. Welcome, Nurse Alice.
Thank you so much for having me. I'm delighted to be here.
Thank you. So, Nurse Alice, really, we got to start off by thanking you for taking the time out of your day to talk with us. And before we start, could I ask you to briefly introduce yourself and your background to our audience? And whilst you do that, can I also ask you to please tell us what all those impressive letters following your title mean to us so we can understand that?
Yes, so I am Alice Benjamin. Many know me as Nurse Alice. I am a family nurse practitioner currently working in the emergency room. I also do some family medicine and cardiac clinical nurse specialist. I have lots of letters behind my names, and those are for my degrees, for my licensure, and for my specialty certifications. My specialties include cardiovascular health, which is the CV board certified, certified emergency nurse, that's the CEN, and critical care registered nurse. So emergency, critical care, cardiology, all those kind of high risk areas are the areas in which I work. I'm passionate about them. And I love nursing. I've been in healthcare for going on 25 years. I couldn't think of doing anything else. And even so, outside of healthcare, a lot of my hobbies and favorite pastimes still trickle into things of service, which my mantra is, I like to talk to people before they become my patients. So I thoroughly enjoy having health, wellness, medical conversations just to educate and to empower people so they can make happier, healthier choices so they can, for themselves and for their family. And outside of that, there's time, I'm a mom, an avid gardener and flute player.
Many hats for sure, many hats. Thank you for that. So I'm sure the answer to my next question is going to be obvious to many, but I still want to kick us off by asking that and hearing what your thoughts about this. What about your work, about what you do you feel is really important for us? How do we understand that?
Oh gosh, so as much as I am a healthcare provider, I'm a consumer as well. So that's something I really want people to understand. The work that I do is so important. And what I want people to really understand that oftentimes I'm not just talking the talk, but I'm literally walking the walk, and also to have experience on the other side of those bed rails, many of the health challenges, fears, concerns that many people have about health and accessing the healthcare system. So I really pride myself on what is coined as health literacy, I use as living room language to really break it down and make it simple and digestible as possible. Because healthcare, even the language we use can, it can be very confusing. Very big words like, and I mean, to kind of simplify this though, but if we say hypertension, it's high blood pressure, diabetes, high blood sugar, trying to make it as simple as possible so people can all be on the same page and understand, because I feel like there's such a gap in health education and communicating the significance of some of the most simplest things. And that really really interferes with people's ability to do the simple things to live healthier choices. So I really pride myself on trying to make things understandable, as less fearful, as less scary as much as possible, so people can live healthier lives.
Wonderful. Absolutely. Health literacy is such an important thing to have to understand, what's going on with the body. You only get one body. So I really appreciate the work you do. So as I said earlier, you wear many hats. You are an author, a health advocate, you're America's favorite nurse. So what is a typical day like for you in your field? Well, what do you do when you get up and as part of your work?
Okay. So first thing I do when I get up is I spend some me time stretching, meditating, getting my mindset together for the day, because I generally have very busy days because I work in the emergency room. So you can imagine the pace of that unpredictability of spending a 10-hour, 12-hour shift in the emergency room. So as much as I can in the morning, I take some time for myself. I have to water myself, fill my own cup up. And then, I have my coffee, my breakfast, get my kids off to school, because mommy duties first. And then I head off to, I answer a couple emails because I'm also in media and television. So oftentimes there's communication. I'm trying to stay abreast of news stories, things that are happening in the news. I answer those, and then I'm off to the emergency room. And once I get to the emergency room, you can imagine that it's nonstop, go, taking care of anyone from the 2-month-old who has a fever to the 18-year-old that has an earache, to the 30-year-old who's having some chest pain, to the 60-year-old who's having signs and symptoms of a stroke, to someone else who's coming in needing stitches. It's just unpredictable work schedule. But I have to say this, I thoroughly enjoy it and can easily go with the ebbs and flows of it because I'm so passionate about healthcare. One of my personal stories is I went into healthcare because of my dad. My dad died of sudden cardiac arrest in the emergency room when he was unattended. Small community hospital, not a lot of resources, was unattended, unfortunately died of a sudden cardiac arrest. And it was then that I recognized, we need healthcare providers who are more attentive, who are on it, regardless of color, skin, age, going to treat everyone with the utmost urgency. And so I went in healthcare and said I would become the best cardiac nurse in the world. And I did that, went throughout my journey and specialized in cardiovascular care because I wanted to know everything, understand everything about the heart. And then found my way back into the emergency room as almost like a gatekeeper in the same setting in which my father passed away. I now have the privilege of being in such a setting to make sure patients like that don't slip through the cracks, at least not on my watch.
Thank you for sharing that. And so sorry to hear about how your father lost and further loss of your father. Let me ask, I read that out of high school, you became a nursing assistant, so right out of high school before going on to study for your graduate, your master's, and your post. What is it for you, and maybe it was the experience, the early loss of your father that gave you such a clear sense of knowing that this is the field that you wanted to go into?
Mm-hmm. Well, I'll be honest, I didn't know that I wanted to go into healthcare. I wanted to go into accounting at first. I told my dad, I said, he said, oh, you're going to be a good nurse, because he was in and out of the emergency room with heart attacks and had stroke and things like that. I said, no, Dad, I'm going to be an accountant. But out of high school, I was looking, college kid, you need a job. You're going to school, but you need a job. And because of my dad in and out of the hospital, I had actually learned that you can become a nursing assistant in just a matter of a couple of weeks. And it was a way to enter into the field. I wasn't sure. I wasn't thinking healthcare. I was thinking accounting, but with my experience from helping to take care of my dad, I was able to, right out of high school, become a certified nursing assistant and enter into a field which had so many doors that could open in front of me. And it put me in a setting where it really opened up my eyes. And that, along with the experience of my dad, really motivated me to stay in that field. So from nursing assistant, and I was going to college as I was working. So as from nursing assistant, then I became a licensed vocational nurse. I was able to do that in a year with a diploma program. And having that type of job security and in a role which I really enjoyed the work that I was doing, and I saw that there was opportunities to climb the ladder and get more education and make more money. I thought this is the way to go, because I love taking care of people. So from licensed vocational nurse, and I went and did an associate degree program to become a registered nurse. And then once I was a registered nurse, I still saw that there was more education that could open more doors, more opportunities for me. I was still working full time the whole time, went back and got my bachelor's, then got my master's degree, and then ultimately a postmaster's degree as a family nurse practitioner, because there's just so much in healthcare. And again, with what had happened with my father, I was real passionate about it. And I wanted to be in a position where I can really influence change more than just at the patients in front of me, but impact a whole hospital, impact the whole system, impact the nation. And with that work experience and working with agencies like AARP and American Heart Association, I've been able to do just that with a lot of the community work. So it's been really fulfilling, rewarding, and provided me some great job security.
Was it as you were advocating and advocating for your father, was it where the people you were working with, were they open to hearing what you needed and asking for the help and the attention that your father needed, or was it a bit of an uphill climb?
It's a bit of an uphill climb. I think we know that our healthcare system, it's what we got, right? We got to deal with what we have. But our healthcare system is broken in so many ways and in so many different places. We have a very convoluted healthcare system. Our insurance programs make it very challenging, difficult, and sometimes discouraging for us to go and seek the care that we need. And even when we go into places for care, some of the providers, depending on how much resources they have, are overworked, overwhelmed, don't have enough resources. And so you have this environment that it's hard to make change. It's hard to change. And it's not just changing the environment, it's changing the culture of the people that are there. So I would say with the fire that was burning in me, my passion, and going on for more school, becoming more wiser to how is change made in, policies, procedures, and not just within the hospital, but community influence. And I was able to, thankfully, inspire change, because sometimes you can lead with the stick, or you can lead, you can dangle the carrot. So I've always, fortunately, and maybe it's because I'm just so really passionate about it. People say, "Oh, you're real bubbly." Catch an affinity for what you're doing, Alice. And next thing we know, we're doing more work. But I've been able to inspire people to make changes in certain settings and to change processes to really improve it, not just for the consumer, but also for the healthcare provider. So overall, it's a win-win for everyone.
Thank you. And, it is truly an advantage knowing at an early age what you're passionate about and what you want to do with your life. How was it for you that you realized this dream? You spoke about your experience with your dad, your parents, but what about teachers and mentors? Did they play a role in helping you come along the way?
I wish I could say I had more mentors that were inspiring. Unfortunately, because of where I lived, I lived in an underserved community, and when so a lot of my own personal experience, so not only just with my dad, but going with my mom, my own personal experience, going in to see my provider, sometimes I just felt like there could have been more delivered to me as a consumer for healthcare. So I actually kind of took note of what was missing in my own personal experiences. And then once I became a certified nursing assistant, I was in the environment. So it was so important for me to be in an environment. Then I could be around and see the providers. I'm like, oh my gosh, this is a great doctor. Oh my gosh, this is a great nurse. What are they doing? How are they doing it? And it really filled my cup and inspired me to go back for more school. So I think it was a little bit of both. Some disappointment, some of the disappointment I experienced, but then being in the environment, working as a certified nursing assistant, and I could see other people doing great things, that actually inspired me, because it helped me think like, you know what, there are great providers out there, and I want to be like them, and help flood the workplace with positive, inspired healthcare providers who are going to, go the extra mile, and hopefully change some of the culture and inspire maybe those providers who are kind of mediocre to want to do more and be more and share those stories. Because I think sometimes, not sometimes, smiles are infectious, and more than smiles, but the positive attitude, the optimism, I think that's very inspiring. So I always once I was inspired, I tried to, give that back. And even now I love talking to young people, and you don't even have to be young. I've had people who were in their 60s and like, I'm thinking of going to nursing school. And I just, I love talking to other people, and representation also matters. So I also didn't see a lot of healthcare providers that looked like me. And so, especially now that I've become one, I really take the time to speak to people about entering the profession. And even if they don't want to enter the profession, how they can, what they deserve as consumers.
Wonderful. Thank you for sharing that. I truly believe if you can see it, you can have some sort of aspirational goal to be it. So, and then that's what a lot of these conversations are really all about. So what would you say, you sort of gave us a little bit of insights about what your day is like, what your personality is a little bit like. What would you say are good personality traits for somebody who's considering a career in nursing or healthcare like yourselves? We talk empathy, caring, patience. Well, what are some of the traits that you would say would really set a person in a good place to go into this career?
I think a couple things. So being a people person, because you're in healthcare, it's inevitable. You're there to service people, and people who aren't feeling good, who are in pain, who are distressed, who are sick. So you can imagine that they don't always show up bubbly and nice. So just making sure that you're a people person, someone who's understanding of those type of circumstances. You're open-minded. You're open-minded to people of different walks of life, religion, identities, because you're going to be servicing people of so many different backgrounds and religions. Someone who is patient, who is a good communicator, has good critical thinking skills, because not everything is black and white. And that's why, people say, talk to your doctor for medical advice, because although there's science, there's an art to all of this. And, we really bring that together. You also need to be detail oriented, because people's lives are in my hand. I can't afford to just glaze over the details. I really need to make sure that I'm being diligent. I'm looking at all of those lab values. I'm listening to what is said. I've looked at, I've done a proper and thorough assessment. And then also someone with integrity. You have to have integrity to work in healthcare. People trust us with their lives. And sometimes the work is hard. And sometimes people may want to cut corners, but this is not the field in which you can cut corners, because that can be very damaging.
Well, absolutely, so true. Those are really important traits. I'm also assuming that there's some detective work that goes along with that work.
Yeah. You gotta be a good detective.
Wonderful.
Ask a lot of whys, like, well, why is this? And I'll say this, sorry, I didn't cut you off, but sometimes I'll come across a piece of information and it's like, and then I dig a little deeper. You got to ask the questions, why? And sometimes you got to ask the same question in different ways, because maybe the answer isn't coming out straightforward, but you have to have that. You definitely have to have that detective nose.
I like that. I like that. So I often read about health disparities affecting communities of color. How important would you say it is for us to have advocates and providers that reflect or understand our communities? You touched a little bit upon it earlier, but if you just want to talk a little bit more about that.
Yes, it's extremely important that providers really understand, are open-minded to the community in which they serve. Although there is, there's some hard science to this, there are details and idiosyncrasies to the care that we provide. It's very important for people to be aware. Like, for example, and you don't necessarily, you don't necessarily need to be African American to treat African Americans, but understanding the culture, the customs, even the science and medicine specific to that population. Because when we talk about research and science, I understand those can be very high level conversations, but what we need to understand is, what was the demographics of the people who participated in the study? So, for example, and I'll just say this. So, like with heart attacks, a lot of the early studies that were done on heart attacks were with older white men and how they present: chest pain, chest tightness. It goes, I feel shoulder pain in my shoulder and into my neck. Okay, some very classic symptoms. It feels like elephants on my chest. But women present a little differently. They present with more subtle symptoms. They may have some chest pain, but they might feel some pain between the shoulders of their back. They might present with more anxiety, some of the more subtle symptoms. So in this situation, how men present, how women present. But then also, even like in the science, there are certain medications that may do well in everyone. However, there may be a category or a group of people who do better with a certain kind of medication. So you need to understand that about the science, but then also understand the people in which you're treating. Historically, there's been a lot of mistrust in the Black and Brown communities when it comes to healthcare provider. And that's because of historically things like Tuskegee. And I won't even say historically, like it's so long ago. Even if you think of in the recent years, I would say maybe even it's like 8 or 10 years ago, there have been some things that with pharmaceutical companies in Africa and other things. So we know that our healthcare system was built on systematic racism, that there is inequality. And I think the provider really needs to understand as much as possible, understand or try at least be open to hearing what someone's experience has been with healthcare, because it's not a one size fits all, and everyone has had a different experience. Certain groups a lot worse historically, and because of social determinants of health, understand that it's not that, and I'll use this word. I really dislike it when I hear a provider say, "Oh, they're non-compliant with their medications." For someone like me, I said, "Oh, they've been non-adherent." I understand that, but is it because they didn't have the money to pay for it? They don't drive, and so they didn't have a ride to get to their medications, or maybe it wasn't explained to them well, so they didn't take the medication. So someone who's really, again, and I've been using that word open-minded because you can't assume in healthcare. We know what happens when you assume. And in healthcare, when you make those type of assumptions without really understanding who you're serving, you can really do more harm than good.
Absolutely, absolutely. It's also sadly we hear a lot of reports about the childbirth experience for African American ladies, which can be considerably different to maybe other communities. So I completely appreciate what you share about having correct kind of representation in that field and also understanding of cultural differences.
Yeah.
One place I think where we worked together was during COVID. You were a very important voice in helping us understand the vaccine and things that we can do to stay safe during that time. Have there been other similar situations that you've been involved in before like that?
Well, I would say, I don't know that anyone's been in anything remotely similar to COVID. That is really, wow. I hope we never experience something that devastating.
I'm there with you.
Yes. That was some very trying times. Nation shut down. people dying at alarming rates, and disproportionately so, and having to educate not only the community, but my fellow colleagues about the ever changing things with the virus and vaccines. That was a very challenging time, but I will say this, healthcare is continuously evolving. And I know even as of late, there's an updated COVID vaccine. There is the RSV vaccine. There are updated recommendations on the pneumonia vaccine. And not that I'm focused strictly on vaccines, but you can imagine how the science changes and having to stay abreast on that. Really, one has to be an avid reader and just have a natural curiosity to stay on top of the science, especially after you've gone to medical school, you've gone to nursing school. I'm already licensed. What do you mean I gotta, we have to, it's our duty as healthcare providers to stay abreast of ever-changing information so we can be better providers. But to go back to your question, I don't know that there's ever been as trying times as COVID. My pursuits to keep consumers up to date with the latest health information so they can make the choices, healthier choices, is something that I'm constantly doing every day. I don't know that work will ever be done, or that I can, one can ever really rest from doing so.
I hope I'm with you. I hope we never face a situation like that again. And it seems like, this is a career field where you're constantly learning. It
Yes.
never stops learning. So I appreciate that. So as we want to provide information for folks who are considering this career, what advice or suggestions would you have for young people interested in pursuing a career in your field, or their parents or guardians or even grandparents who might be looking to support them as they pursue a career in this field?
I think it's very important that you meet someone that actually works in the field. You can watch television, you can watch YouTube and all those things and kind of get an idea. You can read about it, but there's nothing like talking to someone who's actually in that field. I've had people who, and we weren't able to do this so much during COVID, but as of lately, a little, as conditions are more relaxed, been able to shadow me or ask me, what is it like in a day as a nurse practitioner? What do you do? Asking sometimes we can think questions are so silly, but really the only silly question is the one not asked. So, how much school did you have to go to? What are some of the things that you study? Like, I think it's really important to connect your young person, whoever this is that's interested in nursing, or maybe it's physical therapy, maybe it's becoming a physician, but connecting them with someone who actually worked in that field so they can and spend some time with them, a day in the life, so they can visually see what's happening. Because some of the things that I experience may not be captured by what I say verbally, and someone just has to see what the multitasking that's required, the communication that's required, the intense conversations that I sometimes have to have with patients and families at the bedside. And then also see the reward that comes with it when you're actually able to help someone, and you can see the relief, the sigh of relief that happens.
Have we lost Nurse Alice?
It looks like she's still there, but frozen.
Okay, let's give her a second to rejoin or unfreeze. And whilst we're doing that, I just want to let our audience know, if you do, we're going to shortly go to questions. If we are able to get Nurse Alice back, please simply raise your hand or put your question in chat. And in just a moment, if we are able to get Nurse Alice back, we'll go to those question and answers for her to provide us some answers. How are we doing with getting Nurse Alice back? Any luck, Marissa?
Not yet. I'm gonna send her a message, and it looks like she's left, so she will probably be jumping right back on. I'll send her an email just to verify. She might have just had a bad connection.
We'll give her a second or two, folks. My apologies for technical difficulties always come up when you least expect them. Okay. In the meantime, I'd also like to tell you about our next conversation, which is going to be on winemaking. So if that's your thing, please join us for our next conversation as we talk to the African American Vintners Associations, and they can tell us what a career in winemaking is all about. I am not sure whether they'll provide any wine, but bring your glass all the same. All right. How are we doing, Marissa?
Good. It looks like Alice has just rejoined us, so she's connected to audio now.
All right. Hello, Nurse Alice. Welcome back.
About that. Technology.
Yes, I was just saying that. But
And also, if I add, if I just add, just because we have that technical, someone in healthcare also there's an ever growing we are now working a lot more with technology as there's advancements. So someone who's opening to working with new and different technologies. So that's something that's definitely come along the way too. We had a technical glitch. I couldn't miss that opportunity to talk.
Absolutely. And, I think telehealth is, as a result of COVID, has become more of a way that folks are connecting with their doctors. So technology makes so much sense. And so you began your career in healthcare, but you also do, as I say, a number of other things. You've gone into television and writing. Tell us a little bit about how that happened.
Yes. So, when I entered into healthcare, my goal is to take care of people. And I wanted to, my ministry is health advocacy. So again, talking to people before they become my patients. And so oftentimes I would have the patient and the family who's directly in front of me. And that was one thing. And so, but the insult had already happened because they were in the hospital setting. So as I did more volunteer work with American Heart and even AARP, I would find myself out in the community talking to everyday citizens. I've actually found myself at the Capitol in Washington, D.C., talking to politicians as well, because they're health consumers too. But I found myself really outside of hospital walls doing a lot of education. And then I was at a American Heart Association fair one day, and I was getting people engaged to get their blood pressures checked, and had to be creative, fun to get them over to me to my booth. And so someone from American Heart Association saw me. They're like, Alice, you seem really engaged with people. You seem to explain things pretty well. Do you mind going on KJLH radio and representing us and talking about how to be heart healthy during the holidays? I said, sure, no problem. So I did the radio event, and it went well. And then they had me come back. They're like, can you talk about signs and symptoms of a stroke? And I said, oh, sure, I can do that. And then I found myself doing radio spots initially with American Heart. Then the producers, as they would move, or they had friends that were in the industry, my name kind of got around a little bit. And then that's when blogging first started, a long time ago, guys. Then I thought, you know what, I'm going to create a website, I'm going to blog, and I'm going to write, and I'm going to share information digitally online. So people who are not in my immediate area, who don't listen to the radio here, can get that information. And then that lent to, because then there's the internet search. Producers would find me online with my blogs, and then I guess they could see the videos of me at American Heart and things. And I was invited to come on television. And then one thing led to another. Next thing I know, and I never planned for this, but from HLN, CNN, Fox, NBC, BBC, TV One, I was getting invited to come on television to talk about health things. And I thought, first, this is cool. It's really cool. It's fun. And I'm getting to do my work and on a larger scale. So when I'm on NBC, I literally have, in the 3 minutes that I might be on, really getting to speak to millions of people. And I'm happy if I help one person. So I imagine out of millions of people who are listening, I'm impacting the lives of others. So I started to, that was something I fell into. But then as I started to do more television, obviously wanting to be respectful of journalism in the field of broadcast, I went back to UCLA and I did some journalism training, some journalism certificate program there, so I could present my best on television. And I've been doing it ever since. So
you caught the bug, the TV
I
bug.
did. I caught the bug, and I'm really proud. I'm really proud that I've had the opportunity to do that. One is as a healthcare provider, as a woman of color, as someone of the nursing profession, to really be able to speak about things. And, I value every healthcare provider that comes on television, but I think because I'm half Filipino and half Black. So I have the Asian and the Black cultures that I grew up in. I'm very familiar with the customs and the foods and all of the foods that we eat and the things that impact our health. And so I think also having that and the experience I have also lends to my ability to be able to talk more about those things without, and it being received well by people of those communities. Representation matters. So sometimes when we see someone who's not of our culture, who we feel doesn't understand how we grew up or why things are the way they are, and they tell us what we should be doing with health, sometimes that can be met and not received well, I should say. And so I'm glad that I am now an additional person who can reach other groups and other communities. One, because I'm passionate about healthcare, and then two, I know what it's like. I've been there.
Absolutely. And I think, like many, just very appreciative of having somebody who understands the culture and is so passionate and available and open to sharing her knowledge in terms of how to keep ourselves happy, safe, and healthy. So thank you for the work that you do. Now, we always want to make sure that we're sharing resources with folks so that they can learn and follow up on things. So if folks, are there any resources, website, places that you know of where young folks can turn to or their parents can turn to learn more about this career, or if they want to follow up, or even if they want to connect with your social media? Are there any sites that you'd like to share?
Yes, so I would say this. I would, because people are probably in a multitude of areas, I would say check with your local junior college or university to see if they have any early start programs. These are usually programs where they do outreach to middle school, high school students. They invite them on campus to speak with nurses, to have a day in the life of what it's like in nursing school, to provide them some exposure and to inform them of what is required to enter in this field. So even early on in middle school or high school, you can adjust your studies or experience to track yourself to entering something like that. I also say, especially for nursing, you can check with your state's American Nursing Association, and they are a wealth of resource. Let them know what area you're in, and hey, I have a rising junior who's interested in nursing or healthcare. They'll be able to provide you some other resources that are happening, that are there for people interested in entering the field. And then myself, I'm always happy to talk to someone about healthcare, and I am very searchable. I make it very easy. I'm Ask Nurse Alice on all social media platforms, and I have a website called Ask Nurse Alice. Literally, if you ask me, I've emailed, I've DM'd, however your young person wants to communicate about nursing. I'm also, and periodically I also do webinars where, and I post them on my website, webinars that to say, hey, we're talking to young people who are interested in entering healthcare, or maybe you're already in college, you're not really sure what you want to do, but helping people to better understand the field of nursing, because there are different levels of nursing. Before you even get into nursing, there's a nursing assistant, then there's a licensed practical nurse, there is the registered nurse. And then even after being a registered nurse, there are advanced practice nurse. There's 4 roles: clinical nurse specialist, nurse practitioner, nurse midwife, and nurse anesthetist. So there are, definitely a career ladder within nursing. And, I'm happy to be a resource as well.
So something, one question that I also have is, how closely do registered nurses work with doctors? Because I believe there's some things that they do in place of doctors. Is that correct?
So, okay, close. So there's a registered nurse. Usually the registered nurse, whenever they're giving a medication or doing a treatment, it's because it's been ordered by a provider. And that provider could be a physician, it could be a nurse practitioner, and it could be or a physician's assistant. Physician associate, that's their new names, a PA. So what there is when you're an advanced practice registered nurse, advanced practice nurse, those 4 roles that I mentioned, clinical nurse specialist, family nurse practitioner, nurse anesthetist, or nurse midwife, those roles have prescriptive authority. They have the ability to diagnose, they have the ability to order tests, procedures. They're able to look at those results, synthesize it, make a diagnosis, and create a treatment plan, prescribe medications, even participate in surgeries and all types of things. So sometimes they're referred to as mid-level providers. And so they are there because there's not enough physicians to take care of everyone. So the advanced practice nurses are really what they call mid-level providers, are additional providers to provide care to the masses, because again, there just aren't enough physicians there. Now, do we do everything exactly like a physician? Not every single thing, but if you look at that Venn diagram, there's definitely a lot of overlap, which is good, because then that means we can get you in your appointment sooner, we can get you seen sooner, and we can get you treated sooner.
Wonderful, wonderful. So a few more questions. What from your work, and I'm sure you'll have a lot to say on this, do you find the most fulfilling?
What's most fulfilling? It's most fulfilling when the people come back and say, "Hey, Nurse Alice, I saw you on TV, or I heard your video, or I was listening to your presentation, and you said to check X, Y, and Z, and I did it. And then, this happened, I had to go through some tests and I did this, but my blood pressure is good now. I'm doing fine now." And so those are, when I hear the stories of people who listened, for example, I had someone who watched a podcast that I did, and I was talking about breast cancer screening, breast cancer awareness, and she'd been very hesitant about getting screenings and thought, you know what? I was talking to Ananda Lewis, who was a former MTV VJ, and talking about her experience. And she said, I watched that interview with you and Ananda, and I scheduled an appointment to get screened. And the unfortunate thing is that she did actually have something suspicious for breast cancer, but she had the biopsy and had it taken care of. So now there's nothing to worry about. So, when I hear things like that, when I hear how I was able to impact someone's life in such a way, and, possibly prevented them from having a worse outcome, that makes me feel good. That really makes me feel good.
Wonderful. And, just to follow up on that, so that's the positive side. Now, I think with any job, there's things that I wish this wasn't part of the work that I had to do. What do you like least about your career?
Sometimes, because I'm in an industry of service, I can come home feeling depleted. It's because I've given myself so much of myself. And part of it is I've done it selflessly, because I've gone through the whole shift, running here, doing this, taking care of patients, and, trying to meet everyone's needs. So no one's in pain, no one's hurting, no one's sick, no one's throwing up, no one falls, that I can sometimes overlook my own self needs. So I didn't really sit down and enjoy my lunch. I scarfed down my lunch in 10 minutes. I held on to, I didn't go to the bathroom. I probably could have went to the bathroom 3 times, but I only went once because I didn't have the time, or I didn't stay hydrated enough, or I've taken on so much emotions because I'm exposed to so much. There's a lot of moral distress. Watching someone hurt, watching someone go through something that you're helpless at preventing can be distressing. So sometimes taking on those stressors without taking care of myself is probably one of the things I like least about the job, because I get home and I'm depleted, and then I don't have anything for myself or my family. So although there will be days like that, there are small things that I make sure I now implement to protect myself, because if my cup is empty, I can't help fill anyone else's cup.
Wonderful. That is so true. It's really important. I think it is kind of a high pressured, I think I'm also assuming a high adrenaline kind of career field. You're constantly go, go, go. To have that time to just find your own time to re-energize, to to build your emotional well-being back up, especially when dealing with sometimes with difficult situations like death or end of life kind of situations. So I can really appreciate you saying that. Well, Nurse Alice, it's been an absolute pleasure talking with you today about your interesting career. Unfortunately, we are out of time. I want to thank you for the conversation and for sharing your very inspirational story. I also want to thank the folks who joined us and listened. We are streaming this live on YouTube, so you can feel free to share or view it again there. And I also ask you to join us next week as we are talking to folks, winemaking folks. We're learning all about careers in winemaking. As I said, bring your glass, maybe. This, as I said earlier, you know, these conversations are really about designed to recognize and celebrate the achievements of African Americans in unique and unfamiliar careers, and to share learnings and insights of those from those currently working in those fields. You know, we really look to, through these conversations, to hope to provide young people, their parents, their guardians, grandparents, information of that they can use to possibly prepare for their own possible journey into these career fields. So we hope you really took some good information away from today's conversation. With that said, Nurse Alice Benjamin, we celebrate you and all that you do. And thank you very much for so generously spending your time with us and answering our questions.
Thank you so much for having me. It was my pleasure. I'm happy to help and continue to help. So if anyone wants to reach out or has questions, they can follow me on social media at Ask Nurse Alice or visit my website at asknursealice.com.